Why vertigo isn't always an inner ear problem. If you've ever been told your vertigo is just an inner ear issue and you've done the Epley maneuver or you've taken medication and it's helped, but then the spinning just kept coming back, then this video is for you. I'm Dr. Norris from Koru Chiropractic in Louisville, Colorado, and today I want to explain to you why vertigo and dizziness aren't always an inner ear problem and why so many people stay stuck even when they've done all the right things. In our office, we see people who are frustrated. They've seen ENTs, they've had scans, they've done maneuvers and therapy. Some felt better for a while, but the dizziness came back. And they usually have told us that everything looks normal or you just have to manage it. And that's just confusing because you clearly feel something that isn't right. And the real question becomes, what if we're not really looking in the right place? What if something is being missed? Most people are taught that their balance comes from their inner ears, and that's true partially. But balance is actually a neurological process, and your brain integrates information from three main systems: your eyes, your ears, and your neck and your spine. Your brain is constantly asking, where is my head in space? Where is my body in space? And are those signals matching, right? So if the signals aren't matching, your brain gets confused and disorientated. This confusion at the brain level often feels like, dizziness, lightheadedness, vertigo. So if the inner ear looks fine, but the neck and nervous system is under stress, you can still feel like the room is spinning, even though you've been told the inner ear is totally okay. Let's talk about the neck for a moment. Your upper neck has some of the highest concentration of proprioceptive fibers, which affect balance and coordination and sensory throughout the entire body. Those sensors constantly tell your brain where the head is, how is it moving in space, and how fast is it turning. If the upper neck is irritated, misaligned, or under chronic signals, those can become distorted and your brain is getting mixed messages. So the eyes say one thing, the inner ear says another thing, and the neck says something different. When your brain can't reconcile these messages, it doesn't just ignore them, it tries to integrate them, and it often responds in symptoms. Things like dizziness, things like spinning, lightheadedness, feeling off or unstable. This is also why things like the Epley maneuver can help, but not always hold. As you move crystals in the inner ear, but the neurological stress from the neck remains, you've only addressed part of the system. So the brain is still getting that conflicting input between the neck, the ears, and the eye. And this is what the body does, is it just keeps repeating the pattern, right? It's not failure, it's just simple physiology. At Koru Chiropractic, we don't assume dizziness is only an inner ear problem. We look at the entire neurological balance system. This includes posture, spinal alignment, upper neck mechanics, neurological stress patterns. And we use testing and advanced imaging to see exactly how the spine and nervous system are actually functioning, not just how they look on a basic exam. Then we make really gentle and specific corrections designed to reduce neurological interference. Not force motion, not manipulate you. There's no twisting, there's no cracking, there's no guessing. Just precision. When the nervous system gets clear information, the brain can stabilize again, it can function better, it can feel better, and ultimately, that's when your balance is improving. If you've tried some of those inner ear treatments or medications or therapies and your dizziness keeps coming back, again, it doesn't mean you're broken and it doesn't mean you're out of options. It may simply just mean that the neurological part of the system that hasn't been fully evaluated yet, and that's exactly what we do in our office. So if this sounds like your story or someone you love is dealing with this issue, we'd be happy to help them get clarity. No pressure, no hype, just answers. Thanks for watching, and I'll see you in the next video.